Hello, this is Dawn DeVue Olbrych. I'm a nurse in the middle of EDU 8101 at Walden University as I pursue my EDD in adult education. Your presentation today is an overview of Kolb's learning theory, and our objectives for today are to really have the individuals who are attending be able to discuss a personal learning experience and relate it to Kolb's theory, to identify personal learning styles according to Kolb theory, and to discuss strategies to structure learning opportunities according to Kolb's theory. My goal is to make this theoretical framework come alive for all of us as we talk about how we learn and how we teach to make it be most successful for our students. I really liked Kolb's theory. I've researched it in a number of books and articles, and those are going to be part of the references at the end. In your professional experience, to start out with thinking how we're going to use Kolb's theory, take a few minutes and think about ways that students in your classroom learn. As I presented this to the nurse educators where I work, they talked about the students who learn kinesthetically, and we've all learned about Gardner's multiple intelligence. We have some students who learn by listening, we have some students who learn by reading, we have some students who learn by doing, we have lots of students who learn by a combination of all of the above. So think for a moment about ways that students in your classroom learn. If you can jot those down on your handout, it'll give you a reference point to go backwards to. Kolb's theory applies to all adults, so it should be something that you can find examples of for all of the adults in your learning settings. Next, I'd like you to reflect for a moment about your most effective teaching strategies. Many of us, I teach nursing, many of us use PowerPoint slides, such as what I'm doing today, to sort out what's the best way to give lots of information to students and to provide them a handout so that we can cover significant amounts of content in a fairly compact time and the students have a reference for that. But I think if most of us really reflect on our teaching strategies, probably PowerPoint's not the most powerful strategy that we use. I also teach clinically, and so I find that my most effective teaching strategies are those teachable moments in the clinical arena where we're really looking at a patient, we're applying the theory from the classroom to an actual patient situation where the students can move and think and talk and question, and those tend to be my most effective moments as an instructor. So if you could take just a minute and on your handout, jot down what your most effective teaching strategies are. And then the third component of that, to really start looking at the way that we teach and the way that our students learn, how do you know that a student has gained knowledge? And there's a lot of different ways that we do that. We can certainly have the students post discussions. We can test the students. And in nursing, we test the students a lot because their end result at the end of their program is the NCLEX, the state boards in nursing, which is like a mega cumulative exam for students. And so we have to have our students familiar with the testing so that they can be successful on the NCLEX. That's how we grade the success of the school. But there's also lots of other ways that we determine if our student has gained knowledge. And again, because I feel most effective in the clinical arena or working with case scenarios and clinical stories, I find that my students, I can tell that they've gained knowledge when I watch their clinical performance change from week to week to week. So that's nursing. Take a minute and reflect on how you know that the student has gained knowledge in your particular venue. Kolb postulates that learning is a process. He's a transformative theorist. He believes that knowledge happens then when thinking and behavior change. And he believes that people are learning over a continuum, But one of the ways that we can tell from an evaluative perspective that knowledge has occurred or that learning has occurred is to be able to watch somebody's behavior change or if they can articulate how their thinking has changed. And so if you take the glance at this first slide, and I'm going to refer back to it, Kolb's theory is a cyclical theory. So if you look at the PowerPoint and you go around to the right in a clockwise fashion, he believes that individuals have concrete experiences, and those can be for a novice practitioner when we're teaching the new nurses, those life experiences that they have with wellness and disease, with sickness, with health, whatever framework they want to build it in, and that's their concrete experience that they come into our program with. He believes that if you look at a concrete experience and then you add reflection to it, whereby the student journals, reflects, communicates, articulates what their issues are, they can reflect on that initial observational experience, that initial maybe pre-learning, maybe it's first level to second level learning, that the reflection is an important part of how the student will learn. The next piece in Kolb's theory, which is in our 6 o'clock spot on the PowerPoint, is abstract generalization. And I remember that best in terms of that's where we're bringing the theory to the students' practice. So they've seen something, they've experienced something, they've reflected on it. Now we're bringing theory into it. And then it goes to the last phase on the left-hand side, which is at the 9 o'clock spot. And that's their active experimentation, where they go back into whatever the situation is and determine how they function. And that's where we're going to see learning occurs. Kolb also believes that students go on a continuum, learners go on a continuum from concrete experience to generalization, abstract generalization and theory. So from experience to theory, he believes that students work on a continuum, and he believes there's a continuum between reflection and active experimentation, and people are at different points in that continuum. Kolb's theory goes on to really do a lot of discussion about types of learners. The divergent learner is the person who learns between concrete and reflective. Those are the kind of people that learn from experience and reflection. And he goes around the circle in terms of the types of learner. It was interesting to me to find that Kolb believes that most nurses are divergent learners. And so it's hard to know if they become nurses because they're divergent learners or if they're nurses and they just happen to be divergent learners. But what that means for my students is that they tend to learn best when they're taking experiences and reflecting on it, that's a very powerful mix for the students as they learn. So as we look at the dimensions of learning as they're occurring across the continuum, the concrete experiences provide your frame of reference, your real life experience. And that can be your experience on the outside, or for nursing, it could be freshman experience, and then they transition to senior experience. And then the generalization, really linking that theory to practice. What do facts mean to your experience? It's when the students use logic and ideas to understand. It's when they apply their previous learning to their new learning. So for me, I'm teaching in a 2-year associate degree nursing program. The generalization, that theory piece, is when I can have the students tap into what they've learned freshman level, what they've learned in previous classes, what the core concepts are that track through our curriculum. The continuum between active experimentation and reflective observation is where they're applying the experience to another situation, and reflection allows them to do that. So if we look at active experimentation, if my concept is oxygenation, or my concept, I'll stick with oxygenation, the way that people breathe. So if I look at oxygenation in a well person, and then I look at oxygenation with an individual who has chronic obstructive pulmonary disease or emphysema or asthma, I can apply what I know about breathing to the new situation That's active experimentation. It allows you to test the theory. It lets me apply learning to real situations. I teach the students sterile technique. Sterile technique in a lab is one thing. Sterile technique in the operating room requires a lot more focus because you're running a sterile field that a number of people are touching and interacting with. Sterile technique in the home is different still. Sterile technique then in a real situation is when you drop something that's supposed to be sterile, and then how do you manage that from here on out. Active experimentation, Kolb believes, leads to experience, and as the person gains experience in my field, they become a better nurse. The purpose of reflection is to figure out in your mind, how is this knowledge going to apply to new situations? So, because we believe that nurses are fairly reflective learners, I spend time in my classroom saying, here's your patient with pain. Here's what pain looks like in a person who has no pathology. This is what nerve pain looks like. This is what bone pain feels like, so that you can apply the concepts of pain to new situations. This is the numeric scale 1 to 10. It'll allow us to grade pain in a person who can communicate. This is a FACES scale that allow us to figure out how to evaluate pain in a child. Reflection allows you to make sense of your experiences. It also allows you to articulate different perspectives so that as you're working with people and talking with people, you can incorporate other perspectives to your narrow view of the world. And reflection is going to add meaning to your situation. Take a moment, and as you look on your handout, my handout sorts out from nursing perspective, to look at some concrete and abstract conceptualization. So the example that I posted, concrete experience, feeling short of breath. And then the abstract conceptualization, that's related to the concept of oxygenation when you're a nurse. People will be able to sort out, based on their areas of expertise, what is a concrete thing that is an experience that your adult learner is going to have, or that you as an adult learner is going to have, and the abstract conceptualization. For many of us in this online learning environment, the concrete experience can be related to posting on the discussion board, and the conceptualization, the theory behind that, is group learning, group thought process, how reflection helps you to sort out different learning theories, exactly how it is we're going to manage it. Certainly our success in other online learning environments can bring us forward to whatever the abstract concept is. Perhaps it's going to be a concept related to Knowles' theory and how we're going to manage the concrete experience of our online education associated with that. I'd also like you to take a moment to look at active experimentation and reflective observation. An example that I've posed here is related to sterile technique, because that's something that we use a tremendous amount in nursing. Practicing sterile technique, learning the basics of sterile technique, how to put on gloves, how to change a dressing, that's core for our students. The reflection happens when we discuss with the students, what do you do if you drop whatever, the gauze that you're trying to put on, and it falls off the sterile field? How are you going to compensate for that? How are you going to manage it if the patient reaches up and grabs your sterile glove, because then it's not so sterile anymore? How are you going to manage that? An example for us in our online learning environment now, active experimentation, could be the way that we're using Knowles' theories in our own practice as an educator right now. And then reflection, reflecting back about that, which we've been doing in some of our discussion posts, to sort out, what about Knowles do we like? What about Knowles don't we like? What about Knowles fits with us as a learner? What about Knowles fits with our students as a learner? So take just a moment, and thinking about experiences that you have personally, jot down an active experimentation and an associated reflective observation. And what you see in front of you again is Kolb's theory to kind of give you a sense for the continuum between concrete and generalization, the continuum between active experimentation and reflective observation, and the cyclical nature of his learning theory, knowing that different learners are going to gravitate towards different components of the theory. Some people may need to be more hands-on. Some people may need to be more theory, abstract generalization. Some people may need to reflect more. That allows for the individuality of your learner. I would also postulate then that your individual learning style affects how you teach. I'm a hands-on learner. I tend to teach more hands-on, and I need to pause to allow my students time to reflect, to allow the students who really need to process an opportunity to process. When we talk about reflection, it helps to understand that as you reflect about your actions and combining it with theory, it allows you to have a change in practice. So I'm going to give a nursing example, and then certainly anybody can suggest in our discussion what an example would be from your experience. We do what we call a clinical connect. And so in class, I just taught neuro. I'm teaching chronic neuro disease. I'll have an in-class activity with a case scenario. And my in-class activity today related to chronic neuro was a case scenario of a young patient with MS who's having mobility issues and who's having concerns with her home life and the fact that she would like to have a baby and she needs to figure out how to manage her MS to do that safely. What the students did in class is they reflect. And they reflect about what are the nurse's roles, what are the patient's roles, how does the patient feel, all the components of the situation to deal with safety and mobility, to deal with her optic concerns associated with MS, and to deal with the psychosocial and psychosocial sexual issues related to the changes that happen with a 24-year-old patient who has MS, and related issues with conception and carrying a baby. Then we provided theory for the disease state. So that's where I talk about what are the causes of MS, how does it progress, the fact that 85% of people with MS are in a relapsing remitting type of MS, and I talk about treatment for MS. So clustering your activity, pacing yourself, having time for rest. Then we apply that information now as we go into clinical to a patient that's on the unit that has MS. So the patient in our case study in school was 24 years old. The patient that's up on the neuro unit might be 45 years old. Our patient in our case study was a young woman who is of normal body mass. The patient up on the unit is going to be an older person, might be obese. And we'll talk about how that information is the same on the unit and how that information is different, certainly inpatient versus outpatient. In post-conference then, we reflect again on our patient in the unit, bringing the theory in from home, bringing the theory in from class, and bringing the information and relating it to a patient who's different, who's an inpatient patient, and we reflect on what it means for this 45-year-old woman in all components of the situation. And then we provide theory related to other patient populations. How would we manage it if that patient were geriatric patient? How would we manage it differently if that patient had issues with anorexia or alcohol abuse or substance abuse, so that we would be able to figure out what's going on with each patient who's got MS, similarities and differences associated with that. That reflection is really necessary for the nursing students to change their practice and apply their theory across the board. You can also look at reflection in terms of simulation. We do a fair amount of simulation in our program. We have moderate fidelity mannequins, so the mannequin will breathe, its chest will go up and down. I can make the mannequin talk. I can make its breath sounds different and its heart sounds different. And what we're building in our new skills lab is going to allow us to videotape the student interactions with the mannequin And the way that simulation works, and the person who's been doing a lot of the research in simulation is Pam Jeffries out of the University of Indiana, and she's been working with the NLN with simulation. The way that they're looking at simulation, it works beautifully with Kolb's theory. You present the simulated experience, which is your concrete experience. You videotape the students. Then you debrief. That's your reflective observation opportunity. The students watch the video because it's interesting to notice how different what really happened seems to be from what they believe happened. Discuss their actions and thoughts. Then we provide theory as an adjunct to that debriefing, where we talk about, we do a mock code, where we talk about what the ACLS algorithms are, how it is, do you resuscitate somebody? And then you look at how the students clinically practice, and you're watching for changes in behaviors, and that's that active experimentation phase. Kolb is pretty renowned for how easily he applies to simulation. The cycle of learning provides interventions that apply to all types of learners. As we look at the learners, the people who go between active experimentation and concrete experience, so as you're looking at Kolb's theory on your handout between 9 and noon, those tend to be our accommodating learners. They're hands-on learners. The people between noon and 3, between the concrete experience and the reflective observation, those are the diverging learners. They like to be hands-on, but they need an opportunity to reflect. Kolb identified the learners that are in the cycle between reflective observation and abstract generalization, between reflection and theory. Those are converging learners. They like to consider theory separate from the experience when they want to be able to talk about it, and then they'll figure out how to apply it when they actively are in a situation. And then the people between 6 and 9, generalization and active experimentation, those are the assimilating learners. They like best to work theory to practice, but they must also reflect as they go around the circle. Kolb postulates that the type of learner you are shows where you enter the cycle of learning and shows where you are most comfortable in that cycle of learning, but that people still go around the whole cycle of learning. Multiple learning strategies promote active learning for students with multiple learning styles, and that's just a fact of life. It allows the student to focus on the component of the learning cycle that best fits their cycle. So we do better, it fits their style of learning. We do better if we are doing some evaluation of our students, figuring out what their learning style is, and then figuring out how we're going to apply our educational endeavors to match their learning styles. In nursing, we use the description clinical exemplar, but it works for any learning situation that you find yourself in. And if you look at your handout and take a moment, describe a clinical exemplar, something that was just an example of teaching and learning, or an example in your own life, a situation that you found yourself in where learning occurred. It can be anything, where you learned a new skill, where you had something occur that changed your perspective, any kind of clinical exemplar you have. Once you've found a situation where learning occurred, think about what reflection occurred as a result of that experience. A common exemplar that the students use, we have a code orange in the hospital. It's where a patient is in significant distress, cardiovascular distress, but they're not in a cardiac arrest situation. And so the code orange situation is difficult for the students to figure out how to do the assessment for the patient and how to know what is the next step to them to do. So when they're in a code orange situation, we let that unfold, we let them watch, and then we do reflection related to that. As you think about what reflection occurred as a result of your experience, now think about what theoretical concepts impacted on that. In my code orange example, The theoretical concepts are normally hemodynamic stability, respiratory stability. Once you jot down what the theory is that impacts on that experience, now think about, do you do things differently in your life because of that experience? So perhaps your example is the death of a spouse, the death of a parent, how you reflected whether or not you have knowledge of Kubler-Ross and the stages of grieving. Do you do your choices, your future choices, your interactions with your family, your interactions with other elderly people or young people, are they different because of your experience? And then we can sort out if learning occurred. Again, Kolb believes that learning is transformative, so he believes that knowledge happens when thinking or practice changes. What I'd have everybody do now is look at the diagram that you have on your handout of Kolb's theory and identify which cycle is most helpful as you learn, and then reflect on your teaching practice and argue, is the type of learner that you are, does it impact on the type of teacher that you are? And then you can think about ways that you can incorporate different um, teaching strategies to cause a change in practice. And again, I've provided for you an example of a classroom teaching strategy. If you have an in-class activity with a case scenario, the students reflect, you provide your theory, and then you apply it to a clinical experience that you have had or apply it to an experience that you've had in your teaching and learning environment. And then identify teaching strategies that might link Kolb's theory to your educational practice. We may be reflecting, journaling, debriefing using simulation, doing clinical reasoning. We're working with that a fair amount in my clinical practice. The development of a portfolio for the student. What's important for you to take away from this is to have an understanding of Kolb's continuum of learning and of his cycle of learning, to sort out how you can apply Kolb's theory to your own individual practice. I've used a lot of nursing examples, but certainly you'll want to use examples from your own practice. If you're looking for additional resources, this slide is a little bit busy, but these are the different resources that I found that help you to sort out what's available for articles and journal articles that link Kolb's theory to the type of teaching that I do, and certainly there's the different types of teaching that you do. I've got some basic educational resources, and then I have some nursing educational resources. And the resources, because I don't want you to go blind trying to look at the slide, but the resources are available as well on everybody's handout. Please jot down any questions that you have so that we can make this be part of our discussion about this program. I thank you so much for all of your attention. If you can hang on to your handout, we'll be using that as part of our discussion going forward to finish up the components of this presentation. Have a great day.